Hi, good morning. Good morning, everybody, and welcome to the LMP 3MT's Student Success meeting. So today we're going to be talking with some previous competitor of the 3-minute thesis and show you how to approach it. So if we go to the next slide, I'm Dr. Laurent Bozek. I'm a professor faculty of dentistry, cross-appointed at LMP, and I've been running the 3-minute thesis competition for the last 10 years back in University College London, and now here at the University of Toronto Faculty of Dentistry. I'm delighted to be helping the Department of Laboratory of Medicine Pathobiology in setting up the 3MT competition, and together with Dr. Damster, that's also with us here this morning. So next slide. So today is not about me or Dr. Damster teaching you anything about the 3MT. It's about you getting perspective from previous candidates. And first, we've got Atifa, who's a third-year PhD student from LMP who studies lung disease in premature babies. She was a winner of UFT 3-minute thesis competition in 2022 for a talk entitled "Lung Disease in Premature Babies, Are Watermelon the Answer?" She went on to represent the university at the provincial stages and various showcases across Canada. Our second panelist today is Diego Prano, who's a third-year PhD student in dental public health specialty program here at the Faculty of Dentistry. His research aimed to analyze the financial hardship amongst Canadians paying out-of-pocket dental care. He won the faculty 3MT early in 2023, so competition in dentistry, for his talk, A Smile, but at what cost? And finally, but not least, we've got Ayn Keane, who's a fourth-year PhD student from LMP, who studies Lewy body disease and multiple system atrophy. She reached the semi-final at UFT competition early this year for a talk, Same neurodegenerative disease, different pathological inclusion size. Does size matter? Although she didn't win the 3MT competition, she won in another way. A 3MT was seen by the Toronto Star reporter, who subsequently featured her, brought her in contact with people affected with the disease, and she secured at the back of it a very generous donation for research. So this will be your three panelists today, and I'm just going to moderate the conversation. So if we want to go to the next slide, I would let Atifa take over from there.
The answer?
I'd like everyone to take a deep breath. For a majority of us, this won't be a difficult task. Maybe we don't even appreciate the complexity of being able to do that without much thought. Premature babies that are born very early on are at the highest risk of developing bronchopulmonary dysplasia, or BPD. BPD is a type of lung disease that affects the alveoli of the lungs. These are the small grape-like subunits in lungs that are critical for gas exchange and breathing. So these babies struggle with the simple act of breathing. And I'm going to tell you about how watermelons can help with this. 95 to 98% of the lung surface area is covered by type 1 cells. You can see them on the screen in blue. In BPD, these cells get injured, meaning the lungs will have fewer of the grape-like structures and breathing worsens, which tells us we really should be taking a much closer look at these cells. Despite this, the type 1 cells are the most understudied cell type in the lungs, and this is because these cells have been very tricky to work with. The little that we do know about them is from work in adult lungs, which is not the best model for studying premature lungs. So my challenge was to learn how to do this complicated work in tiny newborn lungs. Since starting my project, I've been able to successfully isolate these cells from the newborn lung and grow them in the lab. This allows me to do two things. One, study the effect of inflammation, which is a major component of BPD injury, and two, study different treatments to see if it can help improve injury in the cells. Because unfortunately, current BPD treatments come with significant side effects, and they don't consistently reduce the incidence of BPD. So simply put, we don't have any cures for this lung disease. Now, one very exciting candidate I'm studying is called citrulline. Citrulline is naturally found in watermelons, and it has anti-inflammatory and antioxidant properties, which is great for treating BPD. We know that a significant number of type 1 cells are lost in babies with BPD, but it's not because the cells are dying. It's because the cells lose their identity. They essentially lose their characteristic shape and function, which allows them to do their very important jobs. Fortunately, I found that citrulline prevents this loss of cell identity, allowing the cells to remain as type 1 cells, which is necessary for breathing and lung development. What makes citrulline such a fantastic option is that it's safe, inexpensive, and while we can't give the babies watermelons, we can safely administer citrulline. What makes me most excited about citrulline compared to other drugs being studied is that a majority of them realistically won't be available for use anytime soon. But we're hopeful that in the near future, citrulline will be helpful in treating lung disease in premature babies. Thank you.
Okay, hi everyone. My name is Atifa. For my portion, I thought it would be helpful to talk you through how I thought about my talk and why I did what I did. So the first component is your title, which you're always told to have a catchy title, which is much easier said than done. But for me, how I approached it was I really thought about what are the most important features in my project that I want to highlight and what needs to be in my title. So my actual project title is the effect of L-citrulline on alveolar type 1 epithelial cells in an inflammatory model of neonatal lung disease, which obviously is not suitable for 3MT. You don't want to put your actual project title. You want to put something that's very clear to your audience, right? We have a lay audience in the 3MT, but that still portrays your message. So for me, it was neonatal lung disease. Instead of saying that, you want to make it simple. You want to evoke emotion. So I did lung disease in premature babies. And are watermelons the answer? So that came from the fact that I knew citrulline was found in watermelons. And it's quite a stretch to be able to say, are watermelons the answer? That's not quite what I'm studying. But this is to just really say, get creative. It's okay if it's a stretch. Milk whatever you can that makes your project unique. That's special about your project. So next we have the opening line, and here you're always told to try and have a hook to really grab the audience's attention with your opening line, your first sentence. For me, I did more of a command with I'd like everyone to take a deep breath, which my approach was throughout my whole talk, I kind of have a common theme of talking about breathing, which I thought was the most relatable kind of thing to be talking about to my audience, right? These babies struggle with breathing. Look, we can all breathe just fine. See how simple it is? Well, the babies can't do it. So starting off with that breath and showing them just how simple it is to us, I was aiming to have that contrast, that relatability, I guess. And another important factor here was my pause, which was so difficult to you're speaking to yourself essentially if you're doing it virtually, and having a pause feels like an eternity. And I know thinking that you have a 3-minute talk, it's just 3 minutes, feels like no time, and you want to cram as much as you can about your presentation in there. But honestly, 3 minutes is quite a long time, and it's a lot more effective to have enough pauses and help your audience really digest what you're saying, than you just speaking at lightning rate and just throwing more information out. If you could go to the next slide, please, Jenny. And then here, to start off with, after my opening sentence, I started with my big picture, my background, to really set the stage about what I was going to be talking about. So I addressed my target population, that I was studying premature babies, the actual organ system I was talking about, which was the lungs, and explaining the alveoli, and then the specific disease of interest, which was bronchopulmonary dysplasia. And you'll notice in my talk, I do actually use an acronym. I know we're told to usually avoid these, but I thought it would be quite overwhelming for my audience to constantly be hearing bronchopulmonary dysplasia. But if I just had one acronym in my whole talk, and that was BPD, that it would be okay, that could slide. And then we go to, while you're explaining all this background, you really want to be making sure to break down the scientific terms. So you'll notice in the quote I put in, here was when I was explaining the lung disease that I was talking about, the BPD, and what it does and how it affects the lungs. And I compared the alveoli to grapes and how these grape-like subunits. And I explained that these grape-like subunits are important for gas exchange, But once again, that might not be too lay or lay enough for our audience. So I go back to the breathing, that it essentially affects the breathing. Babies can't breathe. And my last point here is about using your slide when you're talking, right? The point of your slide should be to help your audience visualize your talk. So I'm talking about premature babies. I have a premature baby on my slide. I'm talking about the lungs. You can see that on my slide. The alveoli, and later on when I talk about the citrulline, the treatment, everything is on the slide. And they can follow and look at these different features as I talk about them. Next slide, please. And then comes the bulk of your talk and you talking about your actual project. So the first point that I really wanted to emphasize was balancing having enough background information versus the specific details of your project. The biggest piece of advice and feedback I got after my preliminary talk was that they wanted to hear more about my specific project, the details of my project. And in hindsight, in my preliminary talk, all I spoke about was just broad neonatal lung disease, how it was bad, and the baby's experience with it. There was nothing about my specific cell type in the population I was studying. There was nothing about the specific contribution of this cell type and its injury to the lung disease. So in my thought process was, oh, it's a lay audience. They don't need to know the details. They can just hear about lung disease, which, yes, but it's also, this is a challenge where you're trying to speak about the specifics of your project, but make it accessible to everyone. So I really took on that challenge in the next rounds. And then over here, you're still trying to address the gap in knowledge. Just like when you write a grant, just like when you do a scientific presentation, you still want to talk about the why and the actual gap you're addressing. So for me, I explained that the type 1 cells I was studying were understudied and why I needed to study them, and the need for the new therapies for the lung disease and why we didn't have adequate therapies. Going further into my project, I showed the progress I made and I broke down my aims, because I knew at that point you're about halfway through your talk. You might be losing some people, so you want to really break things down and make it simple for them to understand. So I showed that I had progress in my project by saying I have now been able to isolate these cells after telling them why it's been so difficult to study these cells. And I tell them that this allows me to now do the things in my project. And thinking back, this was still early on in my project. I was about a year and a half, maybe less into my project. So I didn't have that much data, but I still wanted to show that progress. And I broke down my aims into 1 and 2, having the gesture on the screen to allow them to follow me, breaking it down into effective inflammation and then treatment. Next slide, please, Jenny. And then the end of my talk, the close really, and here, if you look at the diagram that comes from Dr. Bozek and Dr. Dempster's talk, the close is really how all that you've been speaking about relates to the real world. Why should they care? Why does this actually matter? So for me, I emphasize these 2 points of the broad public health impacts of the work that I was doing. So why should the world care about what I'm doing and why does it matter? And then ending on a more hopeful, optimistic note by showing also the immediate impact of my work, how it's not all abstract and just something that's going to happen in the distant future. This is something that really could have an effect now. So having a good balance of the two really helps position what you're talking about in the grand scheme of things. Next slide, please, Jenny. And some tips I have. I know it's really difficult to start or plan your whole talk when you have nothing, when you're starting from scratch. What helped me was watching past 3MT talks to get some inspiration. And I would say watch a whole bunch of them because everyone has their own style. So everyone's is going to be a little different, and see what you like about each and how you could incorporate different features that you're seeing. And then, of course, practicing your talk with as many different people as possible, but really think about who your target audience is. So in 3MT, your target audience is a lay audience, a general audience. So it could be anyone, and they should be able to understand what you're talking about. And so knowing that should help guide you as to who you should be practicing with, right? So for me, when I practiced my talk with my supervisor, my PI, she wanted me to include a graph on my slide about rate of lung disease in the babies, which is not really what you need with this kind of a talk, right? So I realized, okay, great, I'm getting some good feedback here, but I don't think this is something I should implement right now because that's not really my audience. So I went to my family and my friends, and your grad peers also have a good idea, right? Your lab members too. Practice with different people, see what kind of feedback you get. And then for me personally, I chose to write a script and to memorize my script because it's very risky. And I don't think this is the place where you want to be thinking about your wording every time you say your talk. It allowed me to have the right wording every single time and to make sure that I stayed within the 3-minute time limit. Because if you suddenly fumble and your sentence is getting very, very long and you pass your time limit, that's also unfortunate. That's all I have on my section. I think I'm passing it on now to Diego to talk us through his.
So Diego's going to talk to us about a smile, but at what cost? Diego?
If you're happy and you know it, you show it in your smile. Protecting our teeth is fundamental. As a toothache can make us shut our eyes to the pain. As much as we would like, having a healthy smile can't be taken for granted. No, no, no. Let's take a look at this case. A patient with tooth pain goes to a dentist and thinks, how much I have to dig into my pocket to pay for my dental treatments? Will my financial safety net be enough to avoid being beaten or eaten by a ferocious shark of debt? Paying out of pocket for dental care may end up being a risky business. Not everybody's financial situation is the same. For example, 1 of every 5 Canadians avoids dental care entirely because of costs. And let me emphasize that a bit more. If we only look at those without insurance, that number, or the proportion of skipped dental care, doubles. Evidently, some patients have to protect their pockets before their smiles. That is why in my PhD, I will assess the financial hardship Canadian households face when paying out of pocket for dental care. And if what we're doing is enough to financially protect them, or what can be proposed. First, I will analyze and review the literature in terms of the conceptualization and the measurement of financial hardship from dental care. Secondly, I will analyze Canadian household spending in the last 10 years to examine financial hardship from dental care, its variations in time, nationally and across provinces. I will assess if having private dental insurance is enough to avoid financial hardship, and I will assess if it can reduce income-related inequalities. Thirdly and finally, I will review and examine if the financial hardship avoided by providing basic dental treatments at no cost to patients who have had cost barriers to dental care. I will measure and estimate the financial situation they could have experienced had they paid out of their pockets for dental care. You know, my study is fundamental. Answering these questions will provide relevant evidence to advocate for universal dental care coverage and protect those most in need. Remember, we all value a smile, but at what cost?
Thank you for sharing the video. Hi everybody. So that was a really nice day to present the 3-minute thesis. The first thing I said was this phrase of, if you're happy and you know it, and you know this is a child song. So I tried to play a little bit with that. And it's important to say in like a disclaimer too, that you shouldn't be singing, but it did work in my case not to play with fire a little bit in that sense. However, I have done this other times and I have changed that a little bit more, because it's interesting how, because my talk is very dramatic, I needed to create this very positive view in the beginning, to kind of engage people with a smile, but then to talk to them about something that is quite dramatic, about people not being able to pay for their dental care, or that because they pay for dental care, end up having some financial consequences. And so that was the first thing I tried. That was the first thing I tried to do in my talk, but that wasn't the first thing I worked on. The first thing I worked on was what my PhD was about. So that was the first thing I tried to structure around my research. And then I tried to think, okay, I should build my slide based on this story. And so you'll see in the next few slides how that developed, but just to say that it's the beginning was actually the last part I concentrated on. And it was actually the part I tried to think more on, oh, I should play more with words, I should play more with my tonality, with my rhythm. And because I'm doing this dramatic, I'm talking about this dramatic experience, I shouldn't engage in that sense so early on. I should probably enter with a very lightweight thing. And all of a sudden, this phrase and this song popped into my head. And I know this is something everybody can relate to. So that worked for me very much. And then finally, on how, when I talked about in all my study is fundamental, that's also trying to play with this rhythm. And obviously, depending on each person, when you're trying to do your 3-minute thesis, and have you seen just previously, all of your background, your history, your experience comes into place. And so a little bit of I have a little bit of background in music. And so there are many things you try to think about how to change rhythm and how that may have an impact. And then you think, well, this word is kind of important. So if I do something with it, maybe I create this emphasis that I want. And I actually, when I wrote my script, I remember writing the script and changing the length and size of the word, so I would remember that in the beginning. Then I completely forgot about it and wrote it in plain words. But it tried to help me think about, okay, I want to emphasize this thing, that my study is important, and because of this and because of that. So, and at the end, I used my title. So my title didn't come until the very end, and try to wrapping up that idea. So if we could go to the next slide, please, Jenny. And so the progress is not a straight line as life. It's very, sometimes you start in one place, then you do something else that doesn't work, but you already spent some time on that. Then you go back and then you say, okay, no, let's start this again. So I have probably written this script in many ways, and I thought about how the story is developing a lot. But it's a great opportunity to try things and to try to be creative and to try to bring into the table things from your own experience, or things that maybe you've seen, or things that you think, oh, this might work. Well, this is the best place to do it, because that's where your creativity flourishes. I mean, the content, the content better than anybody else. So this is more about delivering the message. And then it's about practicing a lot, because you never know how other people would react. That's one thing I actually think I would have done differently. I didn't share as much my 3-minute thesis in the very beginning as I did later on, in later stages. And I remember in 2021, when I first did my 3-minute thesis, it was a very dramatic piece. It was totally different from this very light and happy beginning. So it was a very different situation. And one of the things that changed also was that I started sharing in my second time. I started sharing more about my 3-minute thesis and tried it. And so for example, I practice with my wife and she would say, oh, I like this bit, I didn't like this bit, you could do this differently. And so I started to think, oh yes, maybe this, I could do this, I could do that. And so you could try things. So for me, that was very important. And plus the body language, because obviously it's a little bit different, and we'll talk a little bit about that part, virtual versus in-person presentation. But body language is important. It's very important. I mean, we're not in a black screen and only talking. So it's important to know how you're moving, what you're doing with your hands. It's different. I once saw a video about a theoretical actor and a movie actor. And the difference for them was that the movie actor has the screen and you emphasize only what you want people to see. And the rest, nobody knows. But the theoretical actor, everybody sees everything. So that's something you can see, okay, if they're looking at me, what should I do with my hands? What should I do with my body? And so if we can go to the next slide, please, Jenny. So here, I just want to emphasize the change. So the first slide on the left with the black background, that was the first one the first one I used. And apart from being a little bit complex in terms of one option, second option, what does that mean? My idea was that the insurance or protecting people from financial hardship, from financial consequences, was this vest, people not drowning. But then that was complicated to kind of put in a picture. I thought about other alternatives, but then I thought, okay, if it's not a vest, what is it? Maybe if I put a net, okay, but a net from people drowning. So, but I would have to have like a big pool and people in different lengths. How do I show they are drowning? Maybe I put a rock in their feet and say that depth is this huge rock and they're drowning inside that sea. And then I thought, what if I use a shark? And that shark is resembling death, and that you can be beaten or eaten by death. And so when I created that image, it was super clear for me that was part also of my speech. And so one thing actually also had a feedback to the other. So the slide tells as much of the story as your speech. And it obviously has to reflect what you're putting in your slide. But for me, it kind of helped me in writing the script. So I don't know, maybe others do first the script and then the slide. For me, the slide kind of came about first before I wrote the script. And one more thing I just want to say is that if you see, the title is the same. So the title was exactly the same in both speeches. And in both, I had the same idea, even the cost with the balance of money. But I thought, okay, that came to me. I thought it was a catchy title. It worked, but it's not enough. So all the rest was changed completely from one competition to the other. And so even if you do something once, you can maintain things that worked, but then you can change things that you can actually improve. And for me, the title worked, but the rest could have been better, and that's what I tried to work on in this last one that you've seen. So well, that's my story on this 3-minute thesis, and I'll pass it on to Ayn for her video.
Thank you, Diego. Also, I just wanted to add on to Diego's last part. The U of T 3MT competition actually allows you to change your script or maybe your slide every time you go on to the next stage. So I think that that's very important, that you keep improving and changing things. And unfortunately, I'll probably talk about it a little bit later, but I wasn't able to really adapt that, which I think, unfortunately, I didn't make it to the finals, and that's why I don't have a video, but the title of my presentation was Same Neurodegenerative Disease, Different Pathological Inclusion Size, Does Size Matter? Next slide, please. So just to summarize my 3MT, it was about a specific neurodegenerative disease called multiple system atrophy. And the normal protein in our brain gets converted to the bad protein due to genetic or environmental reasons. And I specify these brown blobs as those bad proteins in the brain. And using artificial intelligence, we're able to subtype them, subclassify them. And the importance of subclassification is that these different patients in different subclusters may react differently to the treatments once they are out in the clinics. And so first I used, for an anchor, I used James, who is in the left bottom corner. And I introduced him as a jazz musician who is no longer able to play the trumpet because he's diagnosed with multiple system atrophy. And so this was something that I wanted to introduce as a relatable comment. Oh, sorry, do you mind going back one more slide? Yes. And so I thought this was something that was relatable. And so I used that anchor, which I constantly go back and mention it or tie it back to my anchor. And my research, the research part was that I introduced the disease of interest, which is multiple system atrophy. And the issue with multiple system atrophy is that the disease course is so short that in order to find the right treatment, we need to also understand the disease a lot more better by subgrouping these depending on what we see in the brain of these patients. And so I also explain my methods, which is kind of conceptual because I use the word blobs instead of protein aggregates, which is much more complicated and would throw people off. And then I close with what will this lead to, which is the rightmost column where there would be patients in subtype A with subtype B or subtype C, depending on these how these blobs look like. Under an unbiased analysis using artificial intelligence, and connecting back to my anchor, talking about how people, a better understanding of disease can pave path for further research so that one day people like James can be treated before severe symptoms take over. If we go to the next slide, please. I wanted to point out why I picked James. I actually used to be a trumpet player and I love playing jazz, but when I thought about what could be relatable, and then I kind of thought back to thinking about what if I had that disease and how would I feel like? And so that really kind of that's what I wanted to really bring out so that the people listening can relate to how severe this disease and what it means to have these to be diagnosed with this. And I use certain technologies like normal or bad instead of native alpha-synuclein protein or misfolded alpha-synuclein aggregates so that it wouldn't throw people off. I used also words blobs where we say protein aggregates or inclusions in the scientific field. And subtypes, disease subtypes, instead of saying there's already subtype C and subtype P, but this would really throw everyone off. So I try to just condense it to different subtypes. And so what I would really do differently actually is to use more lay terms. And to be honest, coming back after 8 months and reading my script and also looking at my slide, I feel like there's a lot that I want to change, and it was very technical. So if the two presentations, Atifa's and Diego's presentations were the good examples, I think mine would kind of show as a bad example. And a lot of things I would like to kind of, there's a lot of things I would like to do differently. Even the title itself, I think that was a little bit too long with a lot of long words, which is not so catchy. And so that's something I would like to do differently in the next round. And even multiple system atrophy, Atifa mentioned like using abbreviations. I think that would have really changed because using the word multiple system atrophy every single time kind of elongated it took a lot of my time, and so I had to rush sometimes, which was not a very good yeah, I think that's pretty much it for me. So next slide, Diego will talk about tips on presenting in person.
Yes, thank you. So presenting in person is quite a journey. It's a really nice thing to do, but it's a very distracting thing to do. So it's, for me, I thought that I had to do or had to practice in different places and in different situations. The first thing was to visit the place, the venue, the stage, see where it was going to be, like try to feel what it's going to be like and project in your mind how it's going to, what's going to happen that day. And so I went to the place, I went to room 170, I think it was. And I remember standing in the place and trying to look at there was nobody but the audience, and try to think, okay, how would I walk? Where would I go? What would I do? I didn't know if we would have a mic or not, or it would be a attached mic, but those things you cannot control. And then say, there are more things you cannot control, specifically your nerves. So when everything's controlled, you don't feel that pressure or that nervousness. And I remember I went to the park to practice once to try to feel more pressure. But even that day, I think, was very special because I felt all of a sudden a huge amount of sensations that distracted me a lot. And I had this script in my mind. I kind of played around it, not specifically, but to the dot. But I kind of remember that I was very distracted by the situation more than other times. And so it's important to start practicing in those, in that context. I tried that again, and try to do it in different situations with friends, families, supervisors, or mentors in public spaces, so that you feel that. And so you kind of understand where that distraction is coming from, and not pay attention to it, and just focus on what's relevant. So the next slide, please, Jenny. And then it's so super important to learn your speech by parts, as you've seen, because then that's easier to remember. It's easier to, okay, where was I going? And also because the story you're trying to draw in everybody's mind is a message. It's not like, nobody has your script. Nobody's actually looking at, oh, did you miss this word? Did you miss this thing? Just like in music, like nobody's really seeing if you missed or did not miss one note, but it's how the message, what you make people feel and where you're taking them. So it's important to draw that painting you want to draw, even if things don't happen as you intended. So even when you're practicing, for me, I think it's important to practice even when you are not following your script 100%. So even if you miss a word, a phrase, or a sentence, okay, continue and finish it, because that can happen. So what would you do? And try to practice with your improvisation, and try to gain confidence on, okay, I'm wrapping up strongly, even if I forget this or forget that, or mess up this word, or use some other phrase. And remember, finally, that nobody knows you're nervous. Nobody knows unless you show them. So even if you're nervous, nobody will know that. That's hidden inside your brain. It really depends on your body language, what you project, how what you try to impersonate, what you try to show. And people obviously find that and like, oh, he's doing or she's doing that, moving like that, or moving this hand like that, or shaking, or those things. So it's what you show them, not actually what's happening behind doors. So that's my last bit. Thank you.
Yeah, and presenting virtually and in recording, using a script, it was highly recommended, especially from Dr. Bozic and Dr. Dempster's workshop, because you can never improvise it, and I really relate to that. And personally, I think memorizing your script is better than reading it off your screen if you're presenting it virtually, because I personally had my script there and I had it memorized still, but I was still very nervous, and I try to find that that's where I was, and then I completely lost where I was, and so I kind of stuttered a little bit. And so I think it might be better that you first, as everyone talked about before, that you practice a lot and memorizing your script as much as you can. And Diego's recommendation was absolutely great, that if you miss a word, keep going. And another point is try to record yourself and assess a few things. So I found it I couldn't watch myself in the beginning when I recorded myself. But if you keep practicing and recording yourself, you can see the different expressions that you make, especially that your voice is loud and what you say, all the words are clear, and you don't slur through words. The tone that you use and any of the gaps. So a lot of the times, I mean, even in Dr. Bozak and Dr. Dempster's workshop, these gaps, when you have them in awkward places, people will think that you ended your sentence or and so on. So it's important to know where to put breaks or pauses, and looking at your facial expressions, hand gestures, and eye movements. Those were the things that I try to practice with recording myself and looking into that and reflecting that. And practicing, do not underestimate the easiness of virtual presentation. Although virtual presentations might seem easier because you have everything there and there's no audience in front of you per se, but I think that I kind of underestimated it and didn't practice as much. And I thought that I have a script there, I'm good. But it's highly important that you practice and try to memorize as much as you can of your script. And also I found that the pace that I had in the beginning when I practiced was good. But when I went on to the actual presentation day, I think I got a little bit nervous and I wanted and now that people were listening to me, my pace was much slower. I think my pace got much lower, and some people might even, go faster than they thought. So I think practicing and pacing yourself and knowing that pace and practicing that would be highly recommended. Thank you.
Okay, so like I was saying, you are totally allowed to change your talk and your slide every round. Either way, you'll notice that the judges at the beginning of the sessions or the end provide their contact info and mention if they're open to people reaching out for feedback after the session. So I would highly recommend that you note down their contact information and reach out to them for feedback, whether you do or don't make it to the next round. It's an opportunity to learn and improve your talk, your skills, either way. And things you can ask them about include your title, your slide, the content of your talk, the actual delivery of your talk, or anything else that they made a note of. So I'm giving an example of how I changed my slide based off of the feedback I was receiving. So this was the first version of my slide where I was told that it was a bit too diagrammy. It didn't really evoke emotion in the audience when they looked at it. Considering I was talking about premature babies and how sick they were and the lung disease, the photo I had on my slide just looked a bit mild. So I tried to change that. Plus a big feedback, like I told you all, I received was that I didn't have enough details about my specific project in my talk. So when we see the next version of the slide, here you can see that now there's a photo of an actual premature baby on the slide. And you'll notice the blue cells on my slide. So when I started talking about the specific cell types I was talking about, I decided to include the actual cells on the slide, make them blue so it was bold, and so I could refer to them as the blue cells on the screen. Because you don't get to use a laser pointer or anything like that. But if something is just visually obvious, you can point it out. So this is what I did for this round. And the feedback I got here was to really think about the flow of my diagram and my slide, which was a bit abstract in the beginning. And I thought, well, can't really think of what else to change about this. But I was told that there was a bit of a disconnect between the baby, the lungs, healthy lungs, diseased lungs, the citrulline and the watermelon, and how they all really link together. And then comes the next version of my slide. So on this one, you'll see that there's a much better use of space on my slide. You don't see these massive white gaps on my slide. And there's a better flow in that the viewer's eyes could flow from one side, so left to right, as it naturally would, right? Because that's how we read, from the diseased lung, the diseased alveoli, going to, oh, we give the baby citrulline, the drug now, and now we get healthy lungs. So even though the difference might not be massive at first, the effect it has, I think, was quite significant. So this is just an example of how to incorporate feedback with your slide, talk, or anything like that. And I think this ends the bigger portion of our talks. Yeah, we have our final takeaways.
So thank you all three for your wonderful contribution. So I was wondering whether the audience have got any question for you, whether you wanted to react a little bit more, maybe in Atifa and Diego, about your presentation. So maybe let's give it any question from the audience. So oh, there is a question from Dr. Dempster.
Yes, thank you very much. That was really great. I mean, to hear your experience in putting this together, it's fabulous. And it's also heartwarming because I think Dr. Bozek and I do talk a lot about the importance of these things, but you know, it's one thing coming from us, it's another thing coming from you who've actually done the presentation. So the one question I guess I just had was, in our course at dentistry, the students have to put together a 3MT. Now, we don't make it voluntary, but I know that there must be this underlying panic that sets in, like, how am I going to say, I've got 3 minutes, which, as you know, can be long, can be short, but is there any sort of words of advice, just short words that you would use to help encourage people to take this and see it as an opportunity to help showcase their science, as opposed to being terrified and panicked that they then have to be present for 3 minutes and somehow sound coherent? So any advice, I guess, to future students, not just the ones who are here with us today, but just in general that we can pass on, because I think that'd be valuable to know.
Yeah, I don't know if you mind if I start off. I thought it was like interesting challenge at first because we don't really do any of these kind of presentations outside of research. So research in general is in conferences, and you have to be very professional. You have to use those specific terminologies. But I thought this was interesting and it was a good practice. And I did want to mention that I think it's not really about winning, but I think it's always good to try out these 3MTs and actually try different stages of the 3MT, even trying it after year, because it really opens up your eyes to how kind of I want to be careful saying this, but kind of narrow in what we study, and being able to communicate that to even within the scientific community and outside the scientific community. I think that's really important, and learning how to do that and opening your eyes to that is actually very important. And so I think, you know, just going into 3MT not expecting to win is also a good thing, just to get your, you know, hands on that and learning about scientific communication. Yeah.
Atifa, Diego, do you want to react as well?
Yeah. Oh, go ahead, Diego.
Oh, so I just wanted to say that the one of the abilities you gain, which is one of the most important, is that you are able to kind of tell your story of your research in plain words, and that people can react to. And I remember I was invited for the Dean's Appreciation, and I was doing also a presentation for some students in statistics about my research. And I kind of did this presentation much more academically, and I thought, oh, I could have used this part. I could have used this or this other thing just to communicate what the problem is or what I was trying to do in some bits. Because when you see your research and you know it's super complex and there's so many things that you have to take into account, or so many assumptions you have to do, you don't have that time with a person that doesn't know anything about what you're trying to do. You don't have that time to kind of transfer that knowledge immediately, but you have to at least make a connection on what's that about, what are you doing, and why is it important. So every time you, during your PhD or during your master's, every time somebody asks you about your research, sometimes you're like, okay, what should I say? When you do your 3-minute thesis, it's much clearer. It's super much clearer, and you can use the resources you've already gained from different phrases or different images, or telling somebody, oh, think if like a person would be I don't know, in this situation and this would be happening. So I think that really helps in your career. And when you do some other research, that will help you too, and will make you communicate with people from different areas, from people that don't know anything about what you do in your field, and bring that, close that gap and create a bridge.
I was just going to say, I can't think of a reason why you shouldn't do it. So I would really encourage everyone to do it, whether either way, it's going to be a great experience. And something I think about, that we owe it to ourselves as junior scientists that have a whole journey ahead of us. We'll have so many situations where you'll be presenting to other peers, other scientists, whether they're specialists in the field or not, and just your general lay person. And I think in school we get a lot of opportunities and good experience presenting to peers and other scientists, but we just don't quite as much get that experience to present to just your ordinary person. So it's a really good preparation for that. And I remember I did my presentation after the 3MT. So there's a charity foundation that funds my lab's work. And they're just a group of, normal people, not scientists, who do this work and support us. I was able to do my 3MT presentation for them, and, to have them all be able to understand what we do at the lab, what their work is funding, where that money is going, is a responsibility we'll have as scientists. So it's really great practice for any kind of a situation.
Great.
Yeah.
Amazing.
Oh yeah, sorry. I just wanted to add on to that, and I know, like I said, it's not really about winning, but also I think winning allows you to showcase your research to other people. I know that Atifa's research was out there in Diego's, and so I think that's really interesting. And what I was very blessed with was that I think a Toronto Star interviewer was in one of the stages, and she reached out to me, and I was able to feature in one of her interviews, and that actually got out to someone who had a friend who unfortunately passed away due to the specific disease that I was studying, and I was able to secure like a generous funding. And so I think that there are other ways where you can also get your research out, and the impact that has, the impact that 3MT has on the community and within scientific community and outside the scientific community is, I think, also very important.
Thank you. There is a question from Nakita in the chat. So I don't know whether Nakita, do you want to unmute yourself? Otherwise, I'm more than happy to read it if you cannot do that.
Hi, yeah, I'd be happy to unmute myself. I just didn't want to interrupt while everybody was talking. But yeah, I just wanted to say it was a super informative presentation. Like, thank you to all the speakers who spoke. It was a really good intro into the 3MT competition and kind of seeing it from a student perspective. So my question, and like I know this was kind of touched on a bit earlier in terms of deciding on a title and a little bit in terms of the slide, but I was just wondering if you guys had any other advice on deciding what aspects of your research or project to include like visually on the slide. I think especially in terms of balancing background info and your own research. But because I know this was touched on earlier, like I understand if you feel like this question has already been properly addressed. I think just for me, it seems so like intimidating from where I am right now, at least. But yeah, any advice you guys have would be super appreciated. And thank you again.
So who would like to start to answer the question? So how do you pick up which element of your thesis?
Yes, I can start. I would say, yeah, it really depends on the story you want to tell. So it's really contextual to your research. and what do you want to say, or what do you think clicks with somebody else? So in my case, for example, I started to create these sharks and debt and safety net, but that's not completely what I'm doing in my research, but it really paints an image of what is happening, and the traumatic situation of not being able to pay for dental care, or paying for it and then having these consequences. So it kind of depends on how you pitch it, and in what ways it works, and in what ways it could, you could kind of mold it to the message. I know Atifa used a watermelon, and she kind of said a little bit about how that isn't specifically about your research, but it kind of hook people to it. So I think it depends really on what you want to say.
And I would add, I think the approach Ayn and Diego had to this slide was quite different to mine. Theirs was very creative, like fun to look at, and mine was very simplistic, like just the bigger picture of just the main things that I was speaking about needed to be on my slide. And that's, I think, my preference, what I like as well. So it's definitely also personal. See what is your preference in that sense too. And this is why I say also watch other 3MTs, so that you get an idea of what kind of approaches people had, and then what features do you actually like and you would want to have in your talk, and what is just not quite you.
Okay, thank you. I had a question. I know that we passed the hour, but just maybe a final question for you, unless there is a final question for the audience. In this case, I'll ask my question, because I think this is going to be very informative. How long did it take to prepare a student thesis? How long did it take you, each of you, to get ready to go on stage and present?
I can start with, I really don't remember specifically, but I prepared. Like so my approach again was to write a script, memorize my script, which takes some time. And another thing I really wanted to make sure I was prepared for, so I know it's been touched on in previous people speaking. So I actually had my script on the screen, at least definitely for the preliminary and the semifinals round. I was really worried about forgetting it, even though I'd memorized it. So I really didn't want that to happen. And an approach I used was to have my script on the screen, but right below my camera. And I made the size of like the doc I had it open on quite small, so my eyes weren't tracking like up and down or like left to right as I was reading it. So it was quite compact right under, which meant I really had to practice to be able to like read it off properly without my eyes moving around. Another thing I had to really prepare for was, I'm the kind of a person that needs feedback from the audience to kind of keep going and like see if people are following me, am I making sense, right? But if you're presenting in person or if you're recording, you're not getting that feedback. So it's really difficult. And I kept finding that my eyes would wander to like my low camera and my screen to look at myself, just to have like a face to get feedback off of. So that was something I really needed to practice to not do. Like I had to tell myself, nope, you can only stare at the camera. That's it. You can't look around because it's really distracting to the audience. All they can see is your slide and your face. And if your eyes are moving around or if your head is moving around, it's very distracting. So it took a while to practice all of those aspects for me.
Diego, Wayne, how long did it take you to?
Yeah, for me, probably a month, I would say, since the first time I tried to create it and then try to practice it and change a little bit of the structure or things. But that's taking into account that 1 year before I was in the course where we did the 3-minute thesis. So that took probably 3 weeks of creating and molding the 3-minute thesis. And then 1 year later, I took a month of revamping and changing things. So yeah, it's not something that comes just like that. As the graph said, it time passes by, you go through different changes, but it's that continuous movement on trying to perfect it that you say, okay, now it's where I want it to be, at least for now.
Thank you, Diego.
Yeah, for me, I think like the LMP was giving like advertising or promoting the University of Toronto 3MT like a month and a half before the saying that the registration was open. And so I did start right away, but I feel like we're really lucky this year that LMP is also hosting this because you can prepare it in advance and be prepared for the University of Toronto wide 3MT. But for me, yeah, I also prepared for about a month. Also reaching out to your friends. My friends had absolutely no idea what I was talking about in the beginning, and so that actually helped me change a lot of things. So, and that took a lot of time getting feedback and then changing feedback and changing. And so, yeah.
Okay, thank you so much, all three of you. So is it final call for question? I don't see any. So I want to thank you all. And there are some important data just being posted currently there on the slide. I want you to pay attention to December 5th about another group feedback. So if you have started to make headways with your 3MT, join us on December the 5th and we can give you some feedback about the structure and how your story is coming about and some comments about your slide as well. But you need to come prepared. If you're coming with your hands in pockets, then basically we can't give you feedback. So it's very, very important to get some feedbacks there. December, February, the peer communication team will provide some coaching service to those who wants to help and perfect the presentation. December 1st, between December 1st and January 7th, just keep on recording yourself. Don't do it on Christmas Eve, or on New Year's Eve, but just keep recording. The more you do it, the better you're going to become at presenting. In January, so remember that for LMP, the deadline for submission will be on midnight on Sunday, January 7th. And that will be communicated how you're supposed to be sending those videos. Throughout January, the judges will review and pick the semi-finalists and finalists depending on the number of entries. February 8th at 5-6 p.m. there'll be an in-person semi-final in LMP. February 24th, the entries will be open for UFT competition, where the MHSC, MSc, and PhD student will be eligible to entry regardless of whether they entered in the LMP competition. Up April 25th, it will be the winners present at the LMP Research Day. So quite a busy schedule. So you've heard today that it takes about a month to get ready. So you've got plenty of time, but don't forget about it. So without further ado, I want to thank you all for joining in today. Dr. Dempster, final word?
No, it was a great day. Thanks everybody for presenting. I think it was very valuable information. I love listening to the talks again. So all good. Thanks everybody.
Thank you so much and have a wonderful rest of the day.